Good day, class. So for our meeting today, I'm going to tackle lesson 4, your micronutrient markers and your trace elements. Now, before we discuss them one by one, let's tackle first the methods and instrumentation used in identifying your micronutrients and your trace elements. Now, take note, class, that the trace elements are often associated with an enzyme, especially metalloenzyme or another protein, a metalloprotein. They act as coenzymes. So yung mga trace elements nyo, class, they act as coenzymes for different enzymes such as metalloenzyme and metalloprotein. Now, there are different methodologies in analyzing your trace elements. We have your atomic absorption spectrometer. Now, under AAS, or the atomic absorption spectrometer, we have the FAAS, or the flame atomic absorption spectroscopy. We also have your graphite furnace atomic absorption spectroscopy. So under AAS class, there are two types, FAAS and GFAAS. Now, this is an analytical procedure for the quantitative determination of elements through the absorption of optical radiation by free atoms in the gas phase. This is the most commonly used instrumentation for trace and toxic metal analysis. Then another method class is your atomic emission spectrometry, or the AES. Now, under AES class, we have your ICP AES. ICP stands for inductively coupled plasma atomic emission spectroscopy. This is a chemical analysis class that uses the intensity of light emitted from a flame plasma. Then we have the last one, the mass spectrometry. Now, under mass spectrometry, we have your ICP-MS, which also has the same meaning. ICP stands for inductively coupled plasma mass spectrometry. Then it uses the ionized gas argon. Now, here's the summary class of the methodologies when it comes to sensitivity, selectivity, elemental coverage, speed for one analyte, multi-element capabilities. Now, kindly memorize this table class. They will come out in your quiz and even in the exam. Now, let's just discuss first the first topic, your aluminum class. Now, aluminum class is a crystalline silver white ductile metal. This is the most abundant metal on Earth, used for beverages, cans, pots, and pans, airplanes, siding, roofing, and foil. Now, ang aluminum nyo class is a very lightweight and sturdy metal. So, magaan siya and very sturdy siya or matibay siya. That's why it's being used on airplanes. Now, absorption, transport, and excretion. It could be absorbed via oral inhalation, and parenteral. Now, aluminum are often bound to carrier proteins. Urine accounts for 95% of aluminum excretion. Take note of that. While 2% are eliminated in the bile. Now, what are the health effects and toxicity? Occurs in people with renal insufficiency who are treated by dialysis with aluminum-contained solution or oral agents that would contain aluminum. So you would see high levels of aluminum class in people having kidney problems, wherein during dialysis they could be treated with aluminum contaminated solution. Now, it could cause the following effects: encephalopathy, which would affect the brain, osteomalacia or aplastic bone disease, and increased left ventricular mass and decreased myocardial function. Lab evaluation class, you could use ICP-MS or GFAAS. Sample use are urine and serum. Now, the second element that we're going to tackle is arsenic. Now, food is the largest source of arsenic exposure. Main current use of arsenic class is a wood preservative. Now, there are two forms of arsenic, organic and inorganic. Now, take note class that arsenic trioxide is odorless, tasteless, and one of the most common poisons in human history. Absorption, transportation, excretion. It is absorbed via ingestion and inhalation. It is usually transported via the renal pathway. Sweat and feces are how it is excreted. So it could be excreted class via the urine, the sweat, and the feces. Major is via the urine. Now, health effects and toxicity. We have what we call arsenicosis class. Now, arsenicosis is the exposure to arsenic. And there are two types, acute arsenic exposure and chronic arsenic exposure. If you have acute arsenic exposure, you would have gastrointestinal, bone marrow, CNS, renal, and hepatic system problems. While for the chronic arsenic exposure, you would have dermatologic, hepatic, cirrhosis and hepatomegaly, cardiovascular, Blackfoot disease, a severe form of peripheral vascular disease. Lab evaluation is by ICP-MS or GFAAS. Sample use is urine and serum. Then we have your cadmium class. Now, cadmium is a soft, bluish white metal which is easily cut with a knife. Manufacture of pigments and batteries as well as in the metal plating and plastic industry. Now, it's usually absorbed via dietary absorption, and inhalation. Absorption of cadmium is higher in females class than in males. Fecal excretion 90%, low absorbance in the gut. Health effects and toxicity would include severe nausea, renal dysfunction, respiratory distress. Then EDTA can be used as a chelating agent in cadmium poisoning. So in cases class na na-poison yung patient due to cadmium, EDTA would be introduced to the body wherein it would chelate. So iti-take niya or kukunin niya yung cadmium from the body. Lab evaluation classes via GFAAS, ICP-MS, and ICP-AES. Specimen would include blood and urine. Then we have chromium. Chromium class is used in the manufacturing of stainless steel, wood treatment, stainless steel welding, chrome plating, leather tanning industry. Absorption is via ingestion inhalation, binds to transferrin and albumin, excreted via renal excretion or via the urine. Health effects and toxicity class. So it is responsible or it helps in the metabolism of glucose, fat, and cholesterol. Chromium deficiency would lead to glucose intolerance, glycosuria, hypercholesterolemia, decreased longevity, decreased sperm count, and impaired fertility. Lab evaluation would include GFAAS or ICP-MS, and specimen is the plasma, the blood, and the urine. Then we have your copper class. So copper class is a very important cofactor for several metalloenzymes and is critical for the reduction of iron in heme synthesis. Now, absorption, usually highest concentration is found in the liver, the brain, the heart, and the kidneys. Now, copper class is transported to the liver bound to albumin, transcuprin, and low molecular weight components in the portal system. So, yung mga transport protein niya are albumin and transcuprin. Excretion is through the bile, urine, and sweat. Health effects class. So, we have copper deficiency. Copper deficiency is characterized by low neutrophil count or neutropenia, hypochromic anemia, osteoporosis, decreased pigmentation of skin and pallor, and Menkes disease. Then we have your copper toxicity. This is a hepatic and renal damage. Wilson's disease characterized by Kaiser-Fleischer rings. Lab evaluation is via flame AAS, ICP-MS, ICP-AES, and ASV. Specimen is the serum and the urine. Now here's the interpretation of copper testing results class. Now I want you to memorize this. There are two things you need to take note when it comes to copper: serum copper and the urine copper. Now, if you have nutritional deficiency, both serum and urine copper are decreased. So kindly memorize this table, class. This may come out in your quiz. Now let's go to iron, class. Now there are two forms of iron, the ferrous and the ferric state, carrier of biochemically active substances and an agent in redox and electron transfer reaction. Absorbed in the intestine, excretion is via the urine, feces, and menstrual loss. Kaya nga yung mga individuals, class, that are having heavy menstruation and those suffering from different gynecological disorder, they tend to become anemic, class, because they have low iron levels. Now you have your so-called iron deficiency anemia. Then there's also your overload in iron, which would lead to hereditary hemochromatosis, excessive dietary iron, medicinal or transfusional iron. Now, in evaluating iron, class, there are four tests that you need to take note of. This, I believe, this was discussed in your hematology one, if you remember sa anemia nyo. We have your total iron content. Now, when it comes to total iron content, class, you're testing for serum iron. Normal value is 50 to 160 microgram per DL. Measures the ferrostate bound to transferrin. Then we have your total iron binding capacity, TIBC, 250 to 300 microgram per DL. This is the amount of iron that could be bound if transferrin and other minor iron binding proteins are present in the serum or plasma sample were saturated. Then we have your percent saturation, usually 20 to 50%, ratio of serum iron to TIBC. Then we have your transferrin, 200 to 400 milligram per DL. Then we have your ferritin, which is the storage form of iron, 20 to 250 microgram per liter. Now, these are the lab markers of iron status in several disease states. So, for every condition, class, we have the four markers that you need to take note of. So, if you're suffering from iron deficiency, you would have decreased serum iron, increased transferrin, decreased ferritin, decreased percent saturation, and increased TIBC. So, do memorize this table, as this will come out in your quiz and even in the exam. Then we have your lead. Now, lead is a soft, bluish white, highly malleable, and ductile metal. This is a poor conductor of electricity and heat and is resistant to corrosion. Also used in the production of batteries. Absorption, class, is via inhalation and ingestion, primarily absorbed in the gut, transported through the blood. Half-life in whole blood, class, is 2 to 3 weeks, then distributed to soft tissue. Excretion is through urine and feces. Health effects and toxicity, class. If there is lead toxicity, too much exposure to lead, it could lead to decreased IQ, clumsiness, headache, behavioral changes, seizures, abdominal pain, and even constipation. Nephropathy and anemia could also occur. Lab evaluation, class, is via ICP-MS, CPAES, and GFAAS. Specimen of choice is whole blood, and then it's characterized with the presence of basophilic stippling. Then we have your mercury. Now, mercury, class, is also known as your quicksilver. This is liquid at room temperature and pressure, used in dental amalgams, electronic switches, germicides, fungicides, and fluorescent light bulb. Used in cosmetics, especially in mascara. Then absorption, transport, and excretion. Exposure of iron through inhalation would be through inhalation, ingestion, injection, cutaneous, and dental amalgams. Inhaled mercury vapor, class, is transported to the lungs. Liquid mercury is passed in the GIT. Storage is via the kidney, and excretion is via the urine and the feces. Health effects and toxicity, we have your mercury toxicity characterized by tremor, impaired coordination, abdominal cramps, diarrhea, dermatitis, polyneuropathy, proteinuria, and hepatic dysfunction. Lab evaluation is via the ICP-MS, called V for AAS, and we have your specimen, blood, and urine. Then we have your manganese class, used in the production of the alloy ferromanganese, essential as a constituent of metalloenzyme and as an enzyme activator. Absorbed in the small intestine, widely distributed in fats and bones. Elimination is via the bile. Health effects and toxicity class. So manganese toxicity would lead to nervous system disorder, could also lead to what we call locura manganica, which is a neurological disorder. Then manganese deficiency would lead to epilepsy, hip abnormality, joint disease, congenital malformation, heart and bone problems, and stunted growth in children. Lab evaluation is via the ICP-MS, GFAAS. Specimens via the urine. Use is urine and serum. Then you have your molybdenum class. So molybdenum is a silvery white, very hard metal. It would occur as molybdenite, wolfenite, and powellite, used for the production of alloys as well as catalysts. Absorption class route of exposure is via ingestion, absorbed predominantly in the stomach and the small intestine. Storage is in the liver, skeleton, and kidney, eliminated via urine and the bile. Health effects and toxicity class, we have your molybdoprotein. This is a cofactor in xanthine oxidase, aldehyde oxidase, and sulfite oxidase. Then we have your molybdenum toxicity class. This is rare and have been linked to elevated uric acid in the blood and an increased incidence of gout. Molybdenum deficiency would lead to seizure, anterior lens dislocation, and decreased brain weight. Now, selenium class is a natural occurring metalloid similar to sulfur, gray to black hexagonal crystal, used in the electronic industry, nutritional supplement, pigments, anti-dandruff shampoo, and fungicide. Absorption, exposure is via ingestion, absorbed from the GIT. Excretion is through urine and feces. Health effects, we have your selenium toxicity would lead to loss of hair and nails, skin lesion, tooth decay, and abnormalities of the nervous system. Selenium deficiency would lead to Cachan disease in children, Cachan-Beck disease in adults. Lab evaluation is via ICP-MS, GFAAS. Specimen is via the urine and blood. Then the last one, we have your zinc glass. So zinc glass is a bluish white lustrous metal that is stable in dry air and becomes covered with a white coating when exposed to moisture. Treatment for Wilson's disease. Absorbed mainly in the small intestine, especially in jejunum. Distributed in the muscle and the skeleton. Zinc gas is eliminated through feces. Then we have what we call your zinc toxicity, characterized by zinc fume fever. See, zinc fume fever class is also known as what we call metal fume fever. This is caused by the exposure to zinc oxide fumes when welding or cutting on zinc coated metals. Now, symptoms of fume fever class would include fever, nausea, fatigue, cough, weakness, head and body ache, sweating over a few hours, and dryness of the throat. Prevention class is the wearing of PPE. Then zinc deficiency would lead to acrodermatitis, enterophatica, growth retardation, slow skeletal maturation, testicular atrophy, and reduces taste perception. Lab evaluation is via AS, ICP-AES, and ICP-MS. Specimen use could be urine and serum. So here are the references for lesson 4. Thank you.